Atrial flutter. That is that the stimulus to make the heartbeat is sent very often, 2, 3, 4 times, as often as that the contraction is happening. So it's very fast sent that the heart should beat, but the contraction of the muscle is not happening. Just 1 and 2, 1 and 3, 1 and 4 times. And in that ratio, it can be 1 and 2, 1 and 3, or 1 and 4 or something. Now, and the symptoms are, it is a sudden onset of the symptoms, and it has angina pectoris, so chest pain, and also breathlessness, and pain on exertion. And the reason it can be myocardial infarction, where part of the heart dies. It can be ischemic heart disease when the blood supply to the heart is restricted. It can be congenital, or it can be rheumatic fever, and there's scarring and inflammation of the heart. If a person thinks they have it, they should seek immediate medical attention, and when it's looked what it is, there can be made an electric shock to the heart to bring it onto normal rate. There is drug treatment to prevent further attacks, and there can be done an electrocardiogram and so on to look what is going on with the heart. And that is according to Keith Hodgkin's Family Medical Advisor book on the page 83, but this is no medical advice. If you click this video away, then please tell me what the reason was so that I can improve. Otherwise, hi and welcome. I'm trying to learn medicine. Today, atrial flutter, and after we've done that, we're gonna do stretching. And if you participate in stretching, then it's at your own risk, and we're just reading it and we're trying to understand it. This is no medical advice, and it is about diseases, internal anatomy, the blood system, and the heart affecting diseases. Atrial flutter. We're trying to go over the text and memorize the points listed so that we're then able to save them from memory. Atrial flutter. An uncommon disturbance of the normal heart rhythm in which heart muscle contractions are stimulated at a very fast, regular rate. I think that regular will mean it's regular, one at a time, but it is very fast. So atrial flutter is very fast heart beating. Only a proportion of stimulation causes contractions of the heart muscle. So they are stimulated at a very fast rate, but only a smaller proportion of the stimulations causes the heart muscle to contract. The ratio of stimulations to contractions may be 2 to 1, or every 3 to 4 to 1. 2, 3, or 4 to 1. Atrial flutter is linked with degenerative heart conditions and is consequently seen most frequently in older people. Symptoms. The onset of symptoms is sudden, awareness of the rapid heartbeat, breathlessness, chest pain on exertion. Okay. Angina pectoris, so chest pain on exertion, breathlessness, and palpitation, awareness of your own heartbeat, and it is sudden. It has a sudden onset. It is awareness of your own heartbeat, breathlessness, and also exertion on exercising. What is it? Chest pain on exertion. Duration. Though atrial flutter may occur in spells, it usually continues until treated. I don't know what spells means, but it can be in spells, but usually it remains until it is treated. Causes. Myocardial infarction, the death of part of the heart muscle. Congenital abnormalities of the heart, ischemic heart disease in which the blood supply is restricted, rheumatic fever which is characterized by scarring and inflammation of the heart. Okay, myocardial infarct by which a part of the heart had died or dies. Myocardial infarct, a part of the heart dies, and it can be congenital, it can be rheumatic fever. There is scarring and inflammation of the heart. Rheumatic fever, scarring and inflammation of the heart, and also ischemic heart disease, restricted blood supply. Restricted blood supply, ischemic heart disease, restricted blood supply, and myocardial infarction, a part of the heart has died, and also congenital is possible, and rheumatic fever, inflammation Scarring and inflammation of the heart. Scarring and inflammation of the heart. Treatment in the home. Remain at rest in bed or a chair until seen by a doctor. When to consult the doctor. If you are aware of a disturbance in the heartbeat, if there is undue breathlessness or chest pain. What the doctor might do, try to slow the heartbeat if it is too fast by pressure on one of the two carotid arteries in the neck. Arrange for an ECG to reveal the nature of disturbance. Send the patient to hospital for treatment by drugs or electric shock to the heart to convert the abnormal rhythm to normal. There can be made an electric shock to the heart to make it beating normally, an electrocardiogram to look how it is working, and pressure on one of the two carotid arteries, on one, maybe that is the point. Pressure on one of the two carotid arteries in the neck. Something about medication. Treatment by drugs. And also medicamentation treatment is possible. Prevention. This depends on the disease causing the condition. See cause above: myocardial infarction, ischemic heart disease, congenital and rheumatic fever. Outlook. When an attack has stopped, drugs may be given to prevent another attack. Long-term outlook will be related to the disease causing the condition. Atrial flutter. It was sudden onset just of symptoms. There was also chest pain on exertion. So sudden onset of symptoms and chest pain, angina pectoris and breathlessness, and palpitations. Ischemic heart disease, irregular blood supply. I'm going to stop the second camera and try to save it. Varicose inflammation, scarring and inflammation, rheumatic fever, scarring and inflammation, congenital and myocardial infarction. Part of the heart has died. It is that the stimulus to make the heartbeat is very fast initiated, but the heart is not beating. Atrial flutter. That is that the stimulus to make the heartbeat is sent very often, 2, 3, 4 times, as often as that the contraction is happening. So it's very fast sent that the heart should beat, but the contraction of the muscle is not happening. Just 1 and 2, 1 and 3, 1 and 4 times. And in that ratio, it can be 1 and 2, 1 and 3, or 1 and 4 or something. Now, and the symptoms are, it is a sudden onset of the symptoms, and it has angina pectoris, so chest pain, and also breathlessness, and pain on exertion. And the reason it can be myocardial infarction, where part of the heart dies. It can be ischemic heart disease when the blood supply to the heart is restricted. It can be congenital, or it can be rheumatic fever, and there's scarring and inflammation of the heart. If a person thinks they have it, they should seek immediate medical attention, and when it's looked what it is, there can be made an electric shock to the heart to bring it onto normal rate. There is drug treatment to prevent further attacks, and there can be done an electrocardiogram and so on to look what is going on with the heart. And that is according to Keith Hodgkin's Family Medical Advisor book on the page 83, but this is now medical advice. Let's have a camera. And we have one other thing. We did in the last part Born-Holm disease, and that was the devil's grip, that people have pain when they're breathing in and so on. People, sudden attacks of severe pain in the upper abdomen or chest. But that goes away after around a week, mostly. But it is still so. If there's pain, it can be also appendicitis, so these things have to be checked if it's not met. But it was said it can be pleuritis, the pleura can be infected. And that is then called pleurisy. And we looked up where the pleura even is, we didn't know it, but now we know what it is. The lungs are separated from the inside of the chest wall by pleura, a delicate membrane which is lubricated by a thin film of fluid. And this allows the lungs to expand and contract smoothly when breathing. And we want the same also in a little video, just that clear. I will start the camera again. The pleura is a delicate membrane separating the lungs from the inner side of the chest. And it is with a thin film of fluid lubricated to make an expansion and moving of the lungs smoothly and easily. That is according to Keith Hodgkin's Family Medical Advisor book on page 411. This is not medical advice. Most of the camera. That was the medical part. If you were here for medicine, you can go directly to the next part of medicine if you stay here and participate in the stretching and is at your risk. The feet are standing together and we're doing routine 3. One toe to the outside and the other toe. The heels and the heels. Toes and the toes. The heels, toes and toes as fast as possible. And now again in, but this time stay down, so go into the knees. Heels, and toes, but stay down this time. And up. Legs shoulder wide apart, breathe in, lift the arms up. And breathe out and go to the side. Breathe again in, out over to the other side, in and up, out and down, one hand slides down the leg, the other shoulder stays down, breathe in, out one arm up, breathe in and over rib cage, out and back, breathe again in, out one hand slides down the leg, breathe again in, out one arm over, breathe in and out rib cage, out and back, have feet standing together, breathe in with the arms up, and out one arm down, breathe in and reach, and out up, breathe in and reach, out one hand down, breathe in and reach, out and up, and both down. Legs shoulder wide apart and shoulder circles back, up, in front, and down. Again, back, up, in front, and down, and in front, up, back, and down. Breathe in, lift the shoulders up, and out, let them fall down. Again, in, out and down. And the apple plucker exercise. Breathe in the arms up. And reach always with one hand higher. Pretend to take an apple hanging high on an apple branch, to turn it a bit around and then turn it a bit out. Last two. And legs wide apart, arms up to a T. Breathe in, and breathe out and shift over to one side. Again in, out over to the other side. Again in, and out we're leaning onto the knees. The buffalo fighting its hangover exercise. Breathe again in, and out one shoulder in front. In, back, out the other one in front. In, back, and again the first shoulder in front. Back, and out. Again back, and breathe in, and out, and we're hanging down the Niagara Falls exercise. Breathe again in, and out, go over to one leg. Breathe again in, and out over to the other leg. Breathe again in, out back into the middle, and close repeat the Salto Angelo exercise. Breathe again in, and out. Again in, and out comes slowly with a round back up, and make it to the backwards shoulder roll. The toes are pointing to the outside. The heels are an ulnar length standing apart. Breathe and lift the arms up. And breathe out and sink down. Elbows against the inside of the knees, and breathe in and straighten up. And out and come with the back up. Breathe again in. And out and down. Breathe in and straighten up. And out and come with a back up. Again in. And out and down. Breathe in and straighten up. And out and come slowly in one straight line upwards. And again down. And the seahorse pose. Stand good on one leg. The heel of one leg on top of the knee of the other leg. Breathe again in. And if you can do it without injuring yourself, sink down. And again. Other leg. Heel on top of the knee. And sink down. And again up. Legs wide apart. And we're doing the trunk igniter. Breathe in. The arms up. Out and down. In and up. Out and down. In and up. Out and down. In and up. Out and down. Breathe in and close the legs. And breathe again out. Wait for the stretching. I thank you very much and until next time.